As a doctor, if a person comes in and tells me their stomach hurts and it hurts really bad, there are some people who will have a little bit of a twinge and they'll come running in thinking they're dying. Other people will be curled up on the floor, barely can stand up, and they think, yeah, I guess I should have to go to the doctor because I can't stand up. Yeah, there you go.
Okay.
And so as I get to know a patient, I can recognize that, this person doesn't complain unless there's really a problem, so I better listen up. Or, boy, this person, will tell me if they've stubbed their toe, and so I can listen a little longer and dig a little deeper. That relationship turns out to be really useful. My granddaddy, my great-grandfather, he was a doctor in Indiana.
Okay.
And that was truly family practice. That was community medicine.
Horse and buggy?
Literally,
Okay.
horse and
All
buggy.
right.
My
All
mom got
right.
to
Okay.
ride with him sometimes in the wagon
All
to
right.
go see patients. And
Okay.
he delivered the babies and he did the surgeries. And, he knew his community. And every time there was a follow-up, he would see the same person. We don't get to do that anymore, but there are ways. If you can establish yourself with a doctor and return to see the same doctor, when you call to schedule, you may have to ask to see the same person. You may have to tell that person, you can sniff around a little bit until you find somebody you like and say, that's my doctor, and I'm going to go see that person. And follow up with them and kind of build that relationship. The partnership between the patient and the doctor is a whole lot of what helps work with a community, help work with an individual, helps move that healthcare forward.
So you're saying is that what you're suggesting is that people take a little time to figure out which doctor they're most likely to want to visit again, and then to try to establish some kind of relationship with that doctor.
Yeah.
And okay, all right.
Minnesota's been, one of the things we talk about is healthcare home. It's also called the patient-centered medical home. It doesn't refer to anybody coming to your house, but it means that clinic, that doctor is your home base. And one of the things that whole concept tries to promote is the relationship between the patient and the doctor, to specify who is the primary care doctor for this patient so that you'll see the same person. It really helps to build up trust. Now, suppose you come to see me about high blood pressure, and I say, oh, your blood pressure is really high, you better take this medicine. Here, take that, and I'll see you again in a month. You're going to go out and say, I never met that doctor before. Maybe she's a pill pusher. Maybe this medicine is going to have too many side effects for me. But if we've known each other for a while, I'll know, well, you're concerned about your dad had a heart attack, for example, and you want to be real sure not to have a heart attack. And I can talk to you about that medicine. I'll say, here's why I think that's important for you. Give me a call if it doesn't work, if you have any questions about it. And when I see you in a month, we'll see how your blood pressure is doing. And that getting to know each other and then coming back to the same person again to check in makes such a difference. And if you start to trust me that I understand what goes on for you and why it's important to you, you'll start to think, well, you could say, I'm worried about that drug because somebody told me they had problems with that drug. And I say, oh, okay, let's talk about that.
Yeah, so I'm sitting here, I'm listening to you, and I do have a doctor like that. I mean, but I think for a lot of people, there's a little bit of skepticism. This is the 21st century, and it means that what you're saying is that people have to be intentional. They have to be intentional around their health care. They have to be intentional about what they want from a doctor. But they also have to know how to ask the questions and things like that. I mean, so what we're doing tonight is just kind of, talking about how do you get to that doctor where, it's not like someone that, you just visit every now and then, but someone that you actually feel like they have a vested interest in your health, but not as much as you do.
Yes. Before you go, it can help to think about, what do I want to get from this visit? How do I want this visit to go? And how do I want my relationship with this doctor to be? The other staff are important too, because you'll get to know, most often the doctor will work with the same nurse or medical assistant over and over, and it helps because you'll often talk to that person on the phone if you call. So it helps to think about what do I think might be going on? What treatment do I think is right? What concerns do I have? Like, people will come in thinking, oh, I'm afraid you're going to give me a drug that's going to have bad side effects. And then you get the prescription, you go out and you say, see, I know it. And you don't take it, but you haven't gotten any help. So if you can think about that a little first, be intentional. Here's what I'm hoping for. And then say that to your doctor. It helps the doctor, too. Doctors are awfully rushed. They don't like it either.
Mm-hmm. So help me. I'm going to go, I need to dig a little bit deeper because I need to figure this out. And what I'm looking for is that you're saying that before I go to the doctor, I need to be thinking about some things. And I need to, and do I need to think about them before I get sick? I mean, or only when I go to the doctors? I mean, I'm just trying to figure it out. Should I be intentional prior to going to a doctor? What should I be asking myself? What kind of questions should I be asking, and what kind of answers should I be expecting from a doctor? Because once again, we talk about, if you don't do that, you go into a clinic wherever, 15, 20 minutes, boom, 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 you're down. So what you're, again, getting back a little bit deeper, you're asking us to think about what do we want from a doctor before we come there? What are we expecting? But then you're also saying that we should have some questions for that doctor. Why don't you walk me through that?
So I think that one of the first things, as you're suggesting, is just to recognize that you get to have wants and expectations and questions. So that's the first piece, is to say, I'm not just a little pebble to be tossed around and tossed out at the end, but I'm the customer here. Mm-hmm. I'm the reason the doctor is doing this. I'm the reason this whole clinic is sitting here. Mm-hmm. And it's easy to feel when you're a patient that you just kind of have to do what the doctor wants and sit here and sit there and give the right sorts of answers. And because you're vulnerable as a patient, you're sick, you're worried about your health, or you have concerns. So it does help to think about that before you go, ideally even before you get sick, which is a reason to do a kind of preventive visit.
Sure.
We could come to that. But so before you go, to recognize that you do get to be in charge of this visit and you matter and you're important. The doctor went to school longer than you may have, than many people did. It was a lot of school. But that doesn't mean that they're the expert about you. You're the expert about you, and you know what you value. You know what your concerns are. You know what resources you have. And you know how you're feeling. And the doctor just doesn't know any of those unless you can communicate. So if you can think about planning to stick with this person, to find somebody you like, and then to stick with them, to let them know what your experience is. Because sometimes, as I say, if you say, I have a headache, they'll say, oh, okay, take some Tylenol. Good, off you go. And you say, no, this headache is really bothering me. Mm-hmm. How is it affecting your life? How does the health issue affect you? And how severe is it? What are your concerns about it? Maybe you have a guess. Maybe there's something you're worried about. I'm like, I think it's probably okay, but, I know somebody who had a headache and it turned out to be a brain tumor. Do you think it could be that? Mm-hmm. So to think about those questions.
Well, one of the things that I like about what you're saying is the fact that, you kind of go in there with an expectation, but you can find out about your doctor before you get there. Mm-hmm. One of the things when I did look you up, you had all these little stars behind your name, so it's like, oh, okay.
As you say, it's the 21st century.
Yeah, it's the 21st century.
Check them out on the internet.
We have to check people out here. Uh-huh. So I think the reason why I'm going down this line of thought is that because we have Minnesota Care, we have insurance here. People can now be a little bit more strategical in terms of how they do what they do in terms of receiving medical services. Okay, mm-hmm. We're talking about accountable care homes. Yep. We're talking about primary care. So while people may have not necessarily done that in the past, I think it's important now for us to be thinking about this. There have been so many people that didn't have insurance in the past, and it's like they in a crapshoot. I'll get what I can get. We don't have to live like that. I think that's the part of this program and why you're here is that there are choices that we can have in terms of our primary care, and there are expectations that we can have from the doctor that serves us.
And I think there's some stuff to learn there about having health insurance when you haven't had it before.
Sure.
Like, heavens, what's a deductible? What's a copay? You said the annual exam. My annual physical was not going to have any charge. Why is there a charge with this? Mm-hmm. And that's something that you can ask about when you go to the clinic. Like, how much is this going to cost me out of pocket? And I think that's worth doing. Doctors sometimes aren't thinking about that either. But when a patient asks about it, you can say, "Oh, right. Let's think about what is this going to cost you? Are you going to be able to get that? Mm-hmm. How are we going to make that work?"
So I want to ask you now about a checkup, a physical exam, and I think a lot of people would say, like, "Well, I get them all the time," and it's like osmosis. I mean, or just like automatic pilot. We're just going to go here and get it. But from a doctor's perspective, from your practice, what do you look for, or what do you think people should be asking when they're going to do a primary check? I mean, I'm just ready glad to get my paper checked off and get out of there. Say, I'm cool. I'm negative at a lot of things. You know what I mean? Like, oh, that's good.
We like that.
Yeah, I like that. But I think that it's important, even though people have been going to the doctors for a long time. It would be nice to hear from your perspective. What do you think people should be asking you, or what should they be looking for from you as a doctor? Again, generalizing things.
There's a couple of different things that tend to happen when somebody comes for an annual exam or a checkup or a physical. Mm-hmm. And I kind of use those to mean the same thing, the physical and the annual. It should include kind of review of your past medical history, meaning like surgeries and hospitalizations. What illness do you have? Should talk about what medications are you taking. How are you smoking? How often do you drink? Ideally, it would ask about, are you eating pretty well? Are you getting some exercise? Do you wear your seatbelts? There's not always time for that. But that's the health maintenance part. It's kind of review of your health or how you're doing. And then to think about what tests or checkups you should have. And that will be based on your age, your gender, your race, certain risk factors. Things like checking your blood pressure and cholesterol, screening tests. Do you need screening tests for cancer? Like, are you due for a mammogram, a colonoscopy for screening for colon cancer, a pap smear, which is a test that looks for cervical cancer. Are there STD tests that you should be having? And then immunizations. Are you up to date on your shots? And then there's the physical exam. So all that is what I consider kind of routine health maintenance visit. Now, at the same time, so that's one part,
sure,
the health maintenance. Same time, the person is coming in and said, okay, this is my once-a-year visit. I just brought me a list of 6 things going on. My knee hurts, and I get stomach aches sometimes, and I got this itch on my elbow. That's the part where sometimes people end up with an extra cost, which is a problem. But it's worth knowing that the checkup in itself is a worthwhile visit to talk about general health maintenance, and that can be a good time to kind of establish a relationship with the doctor. So I wouldn't say don't bring your list, but sort of plan that there's other things too.
So how do you started mentioning a lot of different things, age, race, and all those kind of things. How should people find out about those things before they go to a doctor? For example, I'm 49. I'm not 49, but let's say I'm 49.
Once you were 49.
Yeah, once I was 49. Okay, but there's information out there that says these are some of the things that you should be looking for, and many times, people again or individuals again are very interested in just getting in and getting out. I mean, I don't like getting stuck, and we'll talk about getting stuck a little bit later. Yeah, but it's like I'm not trying to give him more information that make me more vulnerable to getting the needle. You know what I'm saying? Like, I went to the doctor recently, and I thought I'm just going to get a little pre-op check, whatever. Next thing I know, he's throwing an EKG on me, and he's doing sticking. I'm like, oh heck no, I did it because I knew that, well, anyway, I did it because I trusted him. But how do people find out about what are the things they should be looking for at their age?
There's actually a really nice resource online. It's called healthfinder.gov.
Okay.
So it's a health finder, and you put in just your age and sex.
Okay.
And it'll say, okay, as a 52-year-old woman, for example, you ought to have a mammogram. Have you had your colonoscopy? Did you get your flu shot? And it'll kind of walk you through that, and then say if you have extra risk factor, or if you have this or that going on, consider doing these other tests. A family history or a past history. If you've had a new sexual partner, a number of partners, here's something you ought to consider. So healthfinder.gov, I just thought is a really useful site. Quite simple. You put in name, age, or not your name,
right?
Age and gender.
Sure. And
it'll give you that information. And also, when you go there, if you ask specifically, more and more of the electronic health record systems kind of bring that up and put it right in the doctor's face. And you could say, are there tests or things I need to do today? But before you go, healthfinder.gov is a good way.
Okay. Family history. Tell me more about that. I mean, you mentioned that, I don't know if the doctors ask a lot about family history, but why is it important that people understand about family history?
Often that'll be on a form that's written when you come in. And I know I've heard people say, I don't think they ever look at that. But the family history would be part of your chart. And particularly if somebody in your family had something that came at an earlier age than expected.
Sure.
In particular, I think about heart disease and stroke. I think about cancers. I think about diabetes as things that run in families, and that if those were in your family, you may have a higher risk of having it, especially if your family member had it at a young age. If your grandmother had breast cancer at 82, that's not so much of a risk factor as if your mother had it at 42.
And you should be talking to your doctor about this anyway as you're going through this process, right?
Mm-hmm.
Yeah. I think it's important. I mean, tonight's topic is really around kind of questions that you can ask the doctor. What should you be asking him? How should you approach a doctor? How should you find a good doctor? Those kinds of things. And so I think that it's important, again, like you said, to, what is it, healthfinders.gov?
Yep, healthfinder.gov.
Put your name and your information in there. And then to really be willing to ask questions, because I know many times when people talk about going to the doctor, and I'm making an assumption because sometimes I'm those people. You don't want to ask a lot of questions because you want to make people think. I don't know what I want to make people think, but you want to just again get out early. But you also don't want to bring up something that could be a problem.
Yeah,
you know what I'm saying?
You don't want to find out something.
I'm not there to discover I got something different. Right.
Yeah,
Okay.
Yeah.
So how do you help people to become more comfortable, really, in asking the kinds of questions that they need to ask? Is that more of a public? I mean, is that more of a I don't know, a personal or?
I think it's about. I often use the phrase like sniffing out the doctor. You can sniff them a little bit and see when they look at you. Do they see you?
Right.
Do they get it? Are they listening?
Okay.
And you can say in so many words, "I'd like to be partners. I'd like us to work together," and see how do they respond to that.
Right.
See if they'll.
And I think it's a very interesting comment, because I think, as you were talking about before, sometimes people go into a clinic or go into a doctor's office and they feel like they're just nothing but a widget.
Yeah.
And I think you have to demand. You have to demand in a very nice, straight, direct way. Mm-hmm. As you just said, look at me. I am a person, and I have these needs. I'm trying to get some things done, and you need to help me. Or if I can't get it from you, I'm going to find somebody else to do it.
I need some information because I care about my health, and I want to take care of my health and feel good and live for a long time and be there with my kids. And so I want to hear from you how to meet my goals. Let's be partners in this, because the doctor's the expert about prescriptions and tests and physiology and how your heart beats. You, the patient, are the expert in yourself and your own life and what you need and what you know.
Well, Dr. Amy, hold on. We're going to take a station break, and we're going to get back with you. With listeners, we're talking to Dr. Amy Gilbert, and she is a family practitioner, doctor. And she's just talking with us. How do you engage? How do you talk to your doctor about healthcare issues? Thank you, and I will talk to you in a couple of minutes.
What does your world sound like? That's geography, the music of the world around you. Geography is people, places, environments, and economics. Geography gives us the framework for understanding our world. But sadly, our kids aren't getting enough of it. Half can't locate economic powers like Japan and India, and 20% can't even find the Pacific Ocean. That's why we created MyWonderfulWorld.org. It's part of a free National Geographic-led campaign to give our kids the power of global knowledge. Go to MyWonderfulWorld.org to learn more and get your free parent and teacher action kits. It's a wonderful world.
What's it like?
What's it like?
It's lonely.
It's really lonely.
I miss my brother.
I miss my brother.
I'm surrounded by other people, but it's not the same.
I've got other people around me, but it's not the same.
It's pretty scary, but I don't let it rattle me.
It's pretty scary around here, but I don't let it rattle me.
You always have to watch your back.
There's no one to watch my back.
I spend my whole day worried who's out to get me.
I'm always wondering who's out to get me.
But I can take care of myself.
But I can take care of myself.
No matter what, I'll keep my head up.
No matter what, I'll keep my head up.
It's not like I have a choice.
It's not like I have a choice.
This'll all be over in 5 years, 3 months, and 17 days.
This will all be over in 5 years, 3 months, and 17 days.
Go to jail for a gun crime and your family serves a sentence with you. Something to think about before committing a gun crime. Gun crimes hit home. This message brought to you by Project Safe Neighborhoods and the Ad Council.
Hello, and welcome to Community Calendar. I'm Kim Haley. First on the calendar, the AABCA is celebrating the Silver Anniversary Gala and Survivors Ball, celebrating and honoring cancer survivors. It takes place Saturday, October 17th, 5 p.m. at the Marriott Minneapolis West Hotel, located at 9960 Wayzata Boulevard in St. Louis Park. The Men Up Club is for African American males in school or high school. They will help you with school, graduating, teaching manhood, or just having real talk about how to win the game of life as a young black male. The Men Up Club meets every Monday night, 7 p.m. at Shiloh Temple, located at 1201 West Broadway Avenue in North Minneapolis. For more information, Dean 651-895-5033. Pleasure Production is having free stepping classes every Wednesday, 7 to 9 p.m. at Falwell Park, located at Dowling and Humboldt Avenue in North Minneapolis. For more information, Malcolm Samuels, 612-388-2548. Children in America are experiencing all types of domestic violence. 9 out of 10 children who are exposed to physical or verbal violence may be watching negative television. Quincy's Fresh Beat Clubhouse is saying no to domestic violence by turning off adult animated cartoons during family time in the month of October. For more information, Donald Jackson, 612-306-5894 or Quincy'sFreshBeatClubhouse.com. Get the 411 on how to get your driver's license back at the Twin Cities Driver License Rehab, located at 734 East Lake Street in Minneapolis. They're open Monday through Friday, 10 a.m. to 5 p.m. and Saturday, 10 a.m. to 2 p.m. For more information, 612-367-4111 or 612-200-9615. If you or your organization has an announcement you would like to share with the community, bring it in to KMOJ, 2123 West Broadway in North Minneapolis, in the 5 Points Building, Suite 200. For more information, 612-377-0594. I'm Kim Haley. Have a good day.
KMOJ.
All right, so listeners, we're back. We're talking to Dr. Amy Gilbert, who is a family practitioner. and she is here talking with us about talking with your doctors about primary health care, kinds of questions that you could ask them, and so we're excited about this because it gives us a chance to kind of enter into this conversation about what are some of the things that we should be looking for when we go to a doctor, how do we find a doctor, and then what kind of questions can we ask them. So I want to, we talked a little bit more about the needle a little bit earlier. I want to talk about, some of the things that doctors are testing for. For example, almost every time I go to the doctor, they want to take some blood. And, that's not one of my favorite things. Well, I shouldn't say every time I go. Sometimes I'll go and talk my way out of that. But anyway, but exactly why do they want my blood?
Well, there's such a variety of things. I think sometimes people think when they get a blood test, you're being tested for everything.
Correct.
But the doctor is making a very specific order. Some of the common ones might be a cholesterol test, or one it's called a metabolic profile, and it looks at your sodium and potassium, which are electrolytes, at your kidney function, at your blood sugar, and sometimes at liver function. And that gives just kind of a scan. Sometimes we'll get, it's called a CBC for a complete blood cell count. If your red blood cell count is low, that's anemia and might suggest you weren't getting enough iron or coming from some other problem. If the white blood cells are off, it could suggest infection. But they're not testing for everything. You can ask, now exactly what is this test for? Why do I need it? When will I get the results?
And even when you get the results, though, they give you might get a sheet of paper. Like, how do you get them interpreted?
I'm laughing partly because I saw a cartoon recently where the doc hands the patient a piece of paper and says, "Hey, it's Interpret Your Own Lab Results Day."
Right. And sometimes you feel like that. Sometimes you get, you get this information back and it's like 170/85. I don't know. I don't know. The reason I'm approaching this conversation like this is that I think many people have this experience, and we need to figure out a way to help them to find out the answers for those puzzled
I think it may help to ask upstream so that when the test is drawn, to say again, what are you looking for, and what if it's abnormal? What if it's normal?
Sure.
What does that mean? What is it telling me? And what are you, the doctor, learning from it? How is this going to affect my health? So that when they mail you the results, or it turns up online, or the medical assistant calls you with the result, you'll have a little bit of sense of what does this mean. But if not, it's your right. This is your body. It's your information, and it's your right to say, just a sec, I don't understand that. Could you tell me what that means again? And often, again, it'll be the nurse or the medical assistant calling. They're pretty smart. They know a lot about what that means. Sometimes if it's an unusual result or a tricky one, or if you just really aren't getting what you need to know, you could say, could you please ask the doctor to give me a call? And that's part of their job.
So I want to ask you about 2 shots that are very common right now, and there are a lot of conversations about them. One would be vaccines, and the other one would be flu shots. So we're going to take them one at a time. I know that we had a conversation, I think a week or so ago, where there was at one time a lot of dissension, or there was a lot of conversations around vaccines, and we were talking about there was a gentleman from England, I think.
Oh, that crazy man, the guy who talked about autism, right?
Correct.
Yeah. There was a doctor in England, and I'm not sure what got the bee in his bonnet, but he got the idea that vaccines were causing autism, and published a paper that he claimed showed that. Now, part of what happens is that children get a fair number of vaccines in those early years at 2, 4, and 6 months, 12 months, 18, and then again at 5 years. Those are the same ages when children are often diagnosed with autism. So, and so many children are getting vaccines that when a child is diagnosed with autism, chances are they recently had vaccines. Now, there are ways in research that you can kind of help to tease that out, and he didn't do that. He didn't do that accurately, and he kind of had his own axe to grind. And he published a paper that said there was an association between getting vaccines followed by autism. Mm-hmm. That paper was then discredited. In England, there were folks that said, look, this is completely wrong. Here's why. And he was, his license was removed.
But he was a star for a while. I remember looking at the news, and there was a lot of energy around him.
He wasn't allowed to practice anymore in England, and he basically came to the United States. And he hadn't done anything illegal here, and there wasn't a way to stop him, though he didn't have a valid medical license. And he went around promoting this idea that vaccines cause autism.
I think he came in Minnesota.
That's my impression.
Yeah.
I don't know exactly when or what he had to say, but he was, and others have kind of picked up this idea. Autism is so scary. I mean, it occurs when a child is young, and we don't know. We just don't know what causes it. Now, I worked for a while with the Vaccine Safety Data Link.
Sure.
I'm a doctor, right? I've been a fan of vaccines for a long time because I know about some of the really dangerous illnesses that they prevent that we don't see anymore. And so
that was because of the public health perspective, right?
That was public health.
That was
right
public
on.
health, right.
That said, let's get vaccines, health-protecting, life-saving vaccines to lots and lots of people. So we don't even remember what polio looks like. Most of us don't. It's rare that we know what measles looks like.
Sure.
Have you met anybody with tetanus? So it's been a huge success. I mean, it made a huge difference in longevity in the 20th century. But then this new thing turns up. Well, autism has been coming around at the time that people are getting vaccines. So it's hard to... It's been hard to tease them out.
Hard to make a connection, yeah. So let's talk about flus. Flu shots.
Yay
this is
for flu shots.
Okay, well, you're pretty excited about it. I don't know about me.
Here comes the cold and flu season.
Yeah. But I know that periodically there's this huge scare about, we're gonna this flu is coming to town. It's killing people all over the place and things like that. And there are people that are somewhat hesitant about taking a flu shot. No, I don't need that. I don't know that. Or they say something like, well, I got the flu shot and I got sick. You know what I mean? So I'm not going to do it again. So what's your take on flu shots?
I'm for them.
Okay.
So a couple of things is that they're not perfect. Actually, no vaccine is perfect, but the flu shot is variable from year to year because there are different strains of the flu virus that circulate. And they have to make a guess kind of 9 months in advance which strains of the virus will be active this coming winter, this flu season. And so they make the best guesses they can based on how it's been traveling and so on, and put that in the vaccine. And some years it's a very good match, and some years it's not quite as good a match. But even in a bad year, you're going to have a 50-60% lower chance of catching influenza than you would if you didn't have the shot. Mm-hmm. So the other thing is that people are tending to get the shot right during the cold and flu season. Mm-hmm. And there are lots and lots of colds and flu going around. People say, well, I got the shot, and 3 days later, what do you know, I got the flu. From the time you get the shot, whether it's the shot or the nasal drop, from the time you get the vaccinated against the flu,
right.
It takes a couple weeks for your body to produce the antibodies that will protect you. Your body goes to work to make, to be able to fight the flu, such that when you get it, when you're exposed to it, when you're around somebody with the flu who coughs in your face, you're much less likely. Then your body can go to work and fight it off. If you get it, it's likely to be milder. It's likely to be shorter. If you get influenza without being vaccinated, let me tell you just a little about what flu is like.
Sure.
So flu and influenza are the same thing. There's also something called the stomach flu, which is not related to influenza. A couple of years ago, we had a bad season for stomach flu, and I had people say, see, my flu shot didn't work.
Right.
But The influenza vaccine won't protect you from stomach flu, which is a whole different thing. It won't protect you from colds. There's just the one thing, influenza virus. When a person gets sick with influenza, they'll be going around feeling just fine at 10 o'clock in the morning. And all of a sudden, at 2 o'clock, you're like, oh, I've been hit by a truck. I just can't get warm. I'm having shaking chills. I have a fever, body aches, headache, and I'm so fatigued. I've been hit by a truck. That's flu, is abrupt onset. Cough, fever, chills, body aches. And it'll knock you down. You'll be off work for a week, sometimes 2 weeks with influenza.
So let's go back to this thing about there's a difference between stomach flu and the flu.
Yeah.
Okay, so
stomach flu, doctors call it gastroenteritis, meaning your stomach and your intestines are involved. It's usually caused by a virus.
Okay.
And it'll cause vomiting, diarrhea, sometimes crampy stomach aches.
In the wintertime. This happens in the wintertime?
It's much more common in the winter.
Okay. I just wanted to know. Okay.
Yep. Which unfortunately is part of the cold and flu and stomach flu season.
Okay.
And some seasons it's worse than others.
Okay.
Boy, it was 2 winters ago. We just had lots and lots of stomach flu. Very unpleasant. And the flu virus, which is for influenza, does not protect from that. It really doesn't help. So that's an important distinction to be able to make.
So, doctor, when you have people coming to your office and you're talking to people, do you recommend or suggest that they do STIs, STD testing? Or under what circumstances do you recommend that they do those things? Because you're a family practitioner, okay? So you're getting all the
some of everything.
You're getting a little bit of everything. How do you approach that? I mean,
it's
how do you ask the questions?
Yeah, I do it most in young folks. It's just kind of routine. I almost don't ask the questions. I would say I recommend that we just test you for in particular chlamydia, probably gonorrhea, and at least once HIV, because whether just sort of statistically, say we test a person for breast cancer without checking a whole lot of things.
Sure.
You've got breasts and you've got this many years, your age.
And even men have breasts.
True. True.
And men have breast cancer too, just so we throw that out there, okay?
It can happen. Yep.
Yes, it can. Okay,
fortunately, it's less likely.
Less likely. Okay, well, go ahead.
So in young folks, I'll say, let's just get a sample of urine. Let's just do this test and check you for the commonest things, the most important things. They're common. They can cause complications, and they are treatable. Mm-hmm. So let's test you for that and find out if it's there, even if the chances are real small. But after about 25 or 26, then I'll ask a little bit, are you in a relationship? Do you have any sexual partner? In the past, say, 3 months, how many partners have you had? To sort of decide what to recommend.
Mm-hmm. Do you, at times, based on you talked about the age, but do you sometimes, based on other factors, ask people questions about things because you know that their rates are higher? As a family practitioner, mm-hmm. Should you be aware of those kinds of things and be asking people because statistically?
Sometimes I might say people who are at risk for, say, syphilis tend to be those who've had numerous partners. Somebody who's had more than 10 partners in the past, or in the past, say, few months, or somebody who has had sex with people they didn't know who were anonymous.
Sure.
And I would say if any of those fit for you, then I would recommend you have a syphilis test. Would you like to have a syphilis test?
Okay.
I also know that among the common bacterial STDs, by which I mean chlamydia and gonorrhea, mm-hmm. that in Minnesota, gonorrhea is much more common among African Americans than among white Minnesotans, mm-hmm. which makes me think that if I'm screening someone who's African American, that I should be sure and include that test because it would be a shame to miss it.
Mm-hmm. Yeah, I was asking that question because I think that there are some huge disparities in this in Minnesota. Unfortunately, I mean, I was actually talking to a guy today, and he was so he had such a strong passion about the health of the African American community. He was just talking specifically about the African American community, and was just upset because he just couldn't understand why there were so many gaps in so many different places, especially when there's so many clinics and there's so many opportunities. And like I was saying a little bit earlier, is that we have access to, just in many cases, access to insurance. And I think that, it's so important for shows like this to talk about some of these topics in a very broad way. And I was kind of sneaking up on this thing, in a different kind of a way, to just say, like, we should be aware, but also doctors should be aware of the statistics and should be talking and making, very gentle recommendation. I would recommend, what did you say? I just recommend you do this kind of thing, so that people can at least keep it on their radar screen that these are important, and it does affect people within their within their demographics.
And it's important to say, too, that within the African American community, that it doesn't imply that you've had more than 10 partners. Correct. Or anything. Correct. That having had one partner, you unfortunately have a higher risk of gonorrhea just by that one contact.
Sure.
And let's be sure to not miss that, because it's treatable. We can cure it if we know it's there. And sometimes it doesn't have symptoms, both in men and in women. And so it's important to look for it so that you can treat it before it can cause infertility or pelvic pain or complications. Go ahead.
No, your turn.
I was thinking about disparities, and other differences are in rates of certain cancers. African American people have been found to have colon cancer at younger ages sometimes than the white population, and need the recommendations on this vary. But I know the American the GI specialists, the folks who specialize in colon cancer, recommend that African American people have their first colonoscopy starting at age 45, and for white Americans to start at age 50.
There's so many things, about health and about a community health dialogue. And I think that sometimes these are not easy topics to approach, but I think you have to. I think you have to just put it out there. Everybody has their own different way of maybe looking at these things, but I think it's important that it's on the table, and we're looking at it, and we're trying to make a difference in the health of our community.
Not to share the information is not helpful.
And unfortunately, I think that's what's happened in a lot of places, is that there's been information that for some reason did not get out to affected communities, and it's created these huge gaps in terms of disparities. As a family practitioner, how do you talk to parents about their children and bringing the children in to see the doctor?
For, say, child checkups?
How do you help parents understand the importance of bringing their kids in? I know that the parents really want to do the best they can for their child, but I think that there's some things that they should be aware of. There's maybe some conversations that they should have among themselves or with the child. We're just talking about how do you enter into this conversation, this relationship with your doctor. So what do you suggest that they do?
Sort of by way of background, one of the things we talked about in the Maternal and Child Health Program is what we call the trajectory of well-being through the lifespan, and that meaning that what happens with the things that affect a child's health early on will have impact during their life to come, for a long time. And it's those very first early years, the first months and the first couple of years. In particular, it's important to come in to talk about nutrition, growth, safety, vaccinations, parenting. How is that child doing? To help them have a really good foundation. So I'll talk about the sort of schedule of visits that we usually like to see a baby in their first few days or weeks, and then at 2 months, 4 months, 6 months, and then every 3 months till they're 2, then at least once a year till 5. And there's real specific things to talk about at each each of those visits because children change so rapidly.
You know, I was going along with you, listening to you. That I think that helped me because I think I may have had this conversation recently, but it was like we were talking. I was talking recently to someone, and they were talking about they felt like their child was abnormal because she wasn't walking at 13 months. And how do you help parents understand that there's a range?
Yeah.
As a family practitioner, I mean, there's a range. I mean, your baby walked at 8 weeks. 8 months. This other person baby walked at 13 months. That doesn't mean the other baby is slow.
Right.
Right. How do you talk to parents? Because that scares people.
Yeah.
It scared me.
You worry about that, and you don't want to have to hear bad news.
Right.
That's one of those places where a relationship with the doctor can be so helpful. And when that doctor gets to watch that baby growing up, you can say, at the 12-month visit, well, you haven't started walking yet, but I know that your, as we say, the gross motor milestones have been proceeding, and that you could sit up and you could support yourself sitting up, and you rolled over at a reasonable age.
Right.
And so that I think things are on target, and let's see her at the next visit and see how she's doing then. And that sense of continuity is really, really helpful in those early years because things change so quickly.
Right. Yeah, I think that's a great approach because for me, and I did not really think about that until you started talking, was that it would be great for parents to think about who's going to be, the doctor for their child.
Doctor.
Yeah, who's going to be your baby doctor? What kind of relationship can you develop? Because you're gonna have some questions as a parent.
Oh,
about like
Yeah. Yes. Is this normal? Is she okay? What should she eat? When do we start this food? What about his behavior? Is this normal?
Right. Yep. Sometimes it does get to be quite interesting.
One of the things I've enjoyed is a program called Reach Out and Read that from 6 months up to 5 years, every time you come for a well baby visit, sometimes the younger ones, we can give them a free book.
Okay.
And I can talk with the parents about, it's normal for the 6-month baby to be chewing on that book. And that's a good way to use a book when you're 6 months old. We use board books for that reason.
Sure.
And the baby learns to handle it and turn the pages, and we can talk with the parents about the value of reading aloud to that child, and that it's normal to read, for the baby to want to hear the same book over and over and over.
Right.
And that's real healthy for the baby to learn language. And so that's been a really fun program, and it's got some good data about helping kids be ready to learn to read when they get to kindergarten.
Well, one of the things I want to emphasize this from you is that it is important that parents read to their children.
Absolutely.
It is important that parents read their children. I mean,
in a number of ways. It's good for language development. It's good for the relationship between the parents and the child. And that relationship is good for language development. Talk to your baby, sing to your baby, read books, hold books, turn the pages, talk about the book, turn it upside down, play with it. Just having the books around, reading the books is so valuable.
Well, I appreciate that, Dr. Amy. We're coming to the end of our show, and I think that part of what I want to do is to give you a minute. If you had a message to talk to our community about, what would you tell them?
One of the things I'd thought about today was to say that doctors need feedback. Sometimes I'll have a patient come and say, I saw that doctor and they gave me this medicine or this suggestion and it didn't work, so I didn't go back. If in general you liked that doctor at all, if you thought they were sensible and sound, go on back and talk to them and say, here's what happened. Now what? To make the return visit, to follow up, to keep a relationship with the physician is so useful, to have a doctor that you know and that gets to know you, and then you can trust them and they start to know what's important to you.
Well, thank you for that. I really have enjoyed our conversation, and I look forward to talking with you again. And listeners, I want to let you know that if you're interested in maternal child health, you can go to the University of Minnesota on their website and ask for questions about that. I would suggest that because I think that maternal child health is a great subject to study. And Dr. Wendy, I want to thank you for your support and your help in terms of helping us with providing us with speakers for my program. Thank you, listeners, and have a great evening.
Thank you for listening to Community Health Dialogue, sponsored by North Point Health and Wellness Center. Join us next Monday from 6:30 till 7 for more discussions for a healthier community. KMOJ.